My name is Emily Varville. I am the project manager for Leading Age Virginia. As many of you know, Leading Age Virginia is an association of not-for-profit aging services organizations serving the adult day centers, senior housing, assisted living, nursing homes, and home and community-based services. If you missed any of the previous sessions, you can visit our website to view the previously recorded sessions. We will place the direct link for those recordings in the chat right now. And I'm going to start with a few housekeeping notes before moving on to our content for today. If you would like to ask questions, please use the chat option at the bottom of your screen. You may raise your hand if you would like to verbally ask a question, and all links will be placed in the chat as needed. All office hour sessions will be recorded, and you will have access to those recordings and the slides after each session. Most office hour sessions will be set up in a similar format, consisting of a short presentation and an opportunity for Q&A at the end. To respect your center's privacy and to encourage open dialogue about ways to improve infection prevention practices, we will continue recording, or we will end the recording prior to the Q&A session at the end of today's office hours. The office hours will be held the second Wednesday of every month, and the topic will vary. We will be inviting guest speakers to come and give educational presentations about a variety of infection prevention and control topics to ensure that each center can learn about current infection control practices that are applicable to your center. The main content for today's session will be a presentation by Ginger Van Hooser from Virginia Department of Health. One of the topics identified by the Adult Day Needs Assessment was centers wanted more resources and support for adult learning principles and staff training. So today we will be learning about how to use workplace learning principles to make infection prevention and control education fun and long-lasting for center staff. Ginger Van Hooser is the Infection Prevention and Control Educator for Virginia Department of Health's HAI-AR program. Ginger excels in creating innovative educational programs that empower healthcare workers with the knowledge and skills they need to ensure the safety of both patients and staff. Her unique approach combines expert guidance with a touch of fun, making her sessions engaging and memorable. Ginger's insights and lively approach will leave you inspired and armed with the knowledge you need to excel in your role. After the presentation, we'll finish up the session with some important updates and follow up with Q&A. Please help me by welcoming Ginger Van Hooser to our meeting, and you may begin whenever you are ready, Ginger.
Hello, everyone. Welcome to the office hours. I'm Ginger. We're going to be talking about how to spice up and make your education around infection prevention fun, interesting, and make it stick around a little bit longer. So let's go ahead and get started. We are going to look at the idea of, oftentimes when we think about education, we have this idea that if I give people information and knowledge, it will just stick in their head, like it's a data transfer that we can do. But we know that's not how memory works. And so we really have to have some unique approaches to get that information to stick, because it doesn't just automatically happen when you present good information, which is what a lot of education is kind of focused around. So how are we going to get past that idea? So we want to start thinking about some of the barriers that have been identified in Virginia that really keep people from doing good infection prevention education. Next. So when we asked folks, when we went out and did education last year, what are your biggest barriers to infection prevention? I'm going to talk about the top 3 today. So the first one was around planner resources. So that's me. I am the planner of the education, and people often, these are some of their quotes. We got, hundreds of people to tell us what their barriers were. And so they said they had trouble knowing the most up-to-date information. Maybe they were new to infection prevention, or it wasn't what they did all the time, but they were nervous about feeling like they were saying the right things. So if you, as the education planner, are nervous or feel like you really aren't sure what the best things are to talk about, I'm going to give you one tip that helps with that. And it's one of my favorites. It's called nuggets. So when we think about education nuggets, we can think about, go to next. All right, so what we can do is we have this great big piece of education I created around Candida auris. It's available on our website, and it has a lot of information for healthcare workers. But sometimes your folks don't need all of that. So you can just pull out pieces of education and focus on what's most important. Because sometimes people can be overwhelmed, especially if it's a new topic or not something they do all the time. Maybe they don't need to know everything about Candida auris. Maybe they only need to know what happens when we need to clean the environment and make sure we're using the right cleaner. If that's all they really need to focus on, you can pull that one piece out. I love a screen clip just to pull out the piece that you need. Drop it in education so they don't feel overwhelmed by everything else. And if you're using a reliable resource like VDH or CDC, you know your information should be good. So if you're not comfortable with as the planner, pull out what you need and just make it a small nugget. Okay. One of the things about a good nugget is that it stands on its own. So there's got to be enough information that you don't need that big context. It can fit in with other things. So sometimes if you want to talk about maybe just about that cleaner, and then you want to talk about like what are the risk factors for C. auris, you can add more things to it, but they also stand on their own, and they shouldn't take more than 5 minutes to talk about one piece that you want to talk about. And a nice thing about prioritizing nuggets is that you can really help to triage what you need. So maybe there's an outbreak or with GI organisms. So we want to make sure we talk about cleaners first to limit that spread, or that containment to make sure that people aren't spreading it. For its respiratory season, we can give those quick nuggets that are most important. What's the big safety issue that we need to talk about? Okay, so as the planner, if I'm not sure, I'm going to do nuggets. The second thing was about access limitations. So the people that I want to train are really hard to get to, right? So maybe they don't get everyone together. We don't do in-person training anymore. Maybe that we're short-staffed all the time. People don't want to pull out. There's other priorities that they're focusing on. So if you have access limitations to the people that you want to educate, sometimes we got to think about that education a little bit differently. Next. All right, so one of the things, and Emily highlighted this, was sometimes we think about adult learning principles and we're not targeting in on workplace learning, and that they're different areas of study, right? So what I want to learn as an adult if I go back to school is totally different style of learning than what I have to learn at work. So sometimes when we do adult learning principles for like what works in school or higher education, that is not what forced workplace education needs, right? So we got to make sure we're looking at the right things and that we're using the right evidence. So when we're thinking about workplace learning, we got to use workplace learning tools for it. So what does that look like? Next. All right, so there are two main ways that we do workplace learning. One is the primary opportunity. So these are the things where maybe you do handout information, you talk in a staff meeting, you do a workshop, or you do a simulation. These are all the like normal education things, and they can be great. They're going to be my first choice if I get a choice. But if I don't get to see my staff enough to do these things, how can I educate them on infection prevention? And that takes us to these secondary opportunities, which I like to call sprinkles. We're going to sprinkle in infection prevention education. So that can be in the hallway when people are, on their way to do something, you catch them in the moment, maybe not doing their hand hygiene, modeling good behavior, talking with them after something has happened. These moments where you can sprinkle it in are super valuable for workplace learning, and they often come as an afterthought because we really want those primary ones. We want that structured time. That's our ideal, but focusing on secondary education in the workplace, these opportunities are going to be your gold to getting those behaviors to stick. Okay, the last thing we're going to talk about is about how people feel about infection prevention. And our survey, they said they thought it was boring, which I found heartbreaking because I love infection prevention education, but these are actual quotes from people. They said that the training isn't relevant and it's boring. People aren't interested in it. And so thinking about how we approach workplace versus adult learning principles. So if someone doesn't have a choice whether or not they have to do this required training, well, we're going to try to make it fun, but why does that matter? So we want to make sure when we think about education, and Emily, if you can go back one, I think there's one in the middle. So it is evidence-based that education, when it is novel and fun in a way they've never seen it before, it makes it stick, makes more neural pathways. And that's what we want to do. We want that education to have an impact, because every time we see that person, we want to make sure it's valuable. So if we can make it fun, we can make it sticky. And that's what we're trying to do with education. So fun education equals sticky education. So it's not just fun to be silly, it lasts longer, which is ultimately what we want. Okay, so here's an example of a way we made education fun with PPE. PPE kind of a snooze fest, but when you can find fun and engaging ways to talk about it, that really, if the sweet spot is when you do education and people go back like out of the training and they're like, you guys won't believe what we did today. There were squid hats. We did paddles and we played a game, and you've got that all that knowledge in their brain is actually making new neural pathways that sits to the why information and the knowledge that they need. So the next time they go to put PPE on, they're much more likely to remember that fun training and the lessons they learned than if you just went through the step by step. So adding that novel fun piece will make it stick better. All right. Other ways that we did that is through storytelling. So adults love when you think about education. A lot of times if you're going to have an education, people are going to walk up and you're like, here's what I'm teaching you today. But they get really engaged in a story. So how can we capture the imagination, make those new novel pathways by either using a story to engage them in the content, maybe using real life situations so they can place themselves as that character in the education. That's sort of the way that we can really make it sticky for them. So what's the story that we're telling, not just the information we're trying to transfer from one brain to the other that doesn't work. So what did this look like for some of our folks out in the road this summer? So on the left, this group, they only had 45 minutes to make these education posters. We made them make them real fast and just go with their gut. And so on the left, they did getting to know Seors, and it was like it was a dating app. So like, if you are you going to swipe right or left on Canada Oris? Like if you're going to go on a date with them, what do you have to wear? That's your PPE, right? And so it was all set up like a dating match, and whether or not you'd go on a second date with Seoris. And so this story, it tells the same information. It gets you prepared to take care of whoever you need to, but it tells it in a new way that makes it stick. And then the group on the right, they did the roadmap to clean, and they had this train where you had to reorganize the steps for cleaning a space so that it had the least amount of contamination, and they sort of helped you through that. And so by being the train conductor, you got to be able to get them on the road to clean. So those were two ways that we use storytelling. Next. And then really getting away from, we don't want to show and tell someone education. We want to give them opportunities to do some do and tell, get their hands on. So on the left, this group worked with poop, and they could only use the supplies in the room, only had 45 minutes. So they used items they had on hand to make these little bags that were the consistency of different types of poop samples. And they had them put them in order and then say which ones they would send for testing. And so it really went from just, let me tell you about what you need to know, to how can I get you involved? And the group on the right had some matching and quizzing where you had to Velcro the right things around enhanced barrier precautions. So the information is there to teach you, they're there to support you, but you're actually doing something, which again makes new neural pathways, which is what we want to make the education sticky. Next. This was another group of hands-on, and you can see we were not using fancy simulation grade stuff. We had stuffed animals for our patients. We had a stapler standing in for our phone. They used some small elements they had to make it as close to the real world as they could, so that person could put themselves as the main character in that hands-on education that looked familiar to the work that they were doing every day. So it doesn't take a lot to move from just like, let's talk about it, to let's do as much of it as we can and be that main character in the story. All right, I think we have one more, and this was everybody's favorite, was around hand hygiene. And for just like under $5, we could do this training where we use this washable poster paint as the hand sanitizer for them to demonstrate hand hygiene. We made them do it with their eyes closed so you could see the areas that were missed. We also did it with taking on and putting off PPE where it's contaminated, but you can see it. And this red paint kind of raised the risk level a little bit, even though it's washable, to see where you messed up a little bit. Or even if you took your time more, that you could see how you needed to do that every time because you could be contaminated so much. So we gave them handouts so they could redo this education when they went back to their facilities. But most people, they love taking this back. We gave them paint at the training so they could do it and put it into practice. Okay. So thinking about those educator skills that we really want to last. So last year, a lot of these pictures were from the Infection Prevention Educator Roadshow that we did, not just for IPs, but anyone that trains on infection prevention at any type of facility was eligible to come. We're going to do it again this year with totally new lessons. I'm so excited. We do 2 in every region of the state. It's free to come. And you can get a goodie bag of educator supplies like that paint and other things, so you can start doing it right in your facility. So there's going to be some more coming on this soon. And then every Tuesday, so I'm going to jump off in a minute. Every Tuesday at 2, I host a group called Cup of Tea with an IP. Anybody can come to it, and we do a really quick roundup of infection prevention elements for the week. So maybe there's a recall, or look at the respiratory numbers. There's an education nugget that I give you, you can use based on what's going on in the state. And then you can ask other folks on the call, what are you doing about this? Have you seen norovirus numbers go up yet? They usually go up in February. So we're keeping an eye on that, and a chance to get more information about it. So they put in the link, you can register for Cup of Tea, put it on your calendar, and whenever you have a free, or usually only take about 15 minutes for it. It's not a long meeting. It's like, what's new? What do you need help with? Let's go. So you can register for that. Come whenever you have a free few minutes on a Wednesday afternoon. And then I think the last thing I have for you is VIPTA. So on the VIPTA website, Virginia Infection Prevention and Control Training Alliance, it's a mouthful, but they have a library of infection prevention resources where you can click on the topic that you want, and it has more information of maybe you need hand hygiene, educational resources. It can feel overwhelming to go look for them, but this kind of puts them all in one place. So you can find what we think are the better resources so that you can get to them without having to look at a lot of different places. So these are some things that can get you some education. We talked about the ways to use them to be a little bit more impactful and sticky. And if you are interested in doing more hands-on work with me, I'd love to see you at Roadshow this summer. I'm so excited about doing it again and getting back out across the state for hands-on stuff. Oh, Allison, thanks for saying that about Cup of Tea. I think we try to make it accessible, realize that you can get resources from VDH or ask other folks on the call, and really quick, in and out. We don't waste our time. But at the end of the call, there's always time to let us know if you need any additional resources or questions. Okay, I think my last one is a thank you for letting me come and chat today. I know I powered through that because I have to jump off to be at Cup of Tea in a little bit. You've got my contact information there in the chat. Focus on infection prevention education. If you're working on something, if you're stuck, if you don't know where your resources are, be happy to help in any way that I can. Jump on Cup of Tea whenever you're free. I think I have a few minutes if anybody has any questions, if we have time for that, Emily.
We do.
Okay. Is anybody working on anything? Anything work really well for you in education? Anything you're stumped on? Everybody's doing great.
This is Bethany Turner. I am the quality manager at Mountain Empire PACE. So we're a program of all-inclusive care for the elderly. So we're a little bit different than other adult day health centers, but we do have one. And we have been recently trying to beef up our infection prevention and control plans. And one thing that I did want to share, I like how say make it fun, so make it sticky, so whatever. But one thing that we have started doing, we've been using the glow germ stuff for hand hygiene, and I think that has helped tremendously, just because, I mean, of course, we talk about hand hygiene and things like that in our orientation, but it's like you're telling grown adults how to wash their hands. But then whenever you use that glow germ stuff and they can see, it's like, wow, my hand, like I did not wash my hands good. So I'm glad that you gave some more examples of making it sticky, because I think that really does help.
try the paint. So the thing that's happened sometimes with glow germ is either people go off to wash their hands and they do a super good job, never like they would do in the real world, and
Yeah.
come back and maybe don't have anything, or they've scrubbed for 7 minutes and they come back and they still have it, and they're like, well, what's the point? So I like glow germ. We use it at Roadshow. The paint people found more impactful because a lot of people can do it at once and you don't have to like have a black light to check. And you can also use some different colors. So we used red a lot, but if you're having, you can use brown maybe to give a different impact, or green if you want to talk about goobers. Because people need new ways of thinking about it, by switching up, by sometimes I'm doing glow germ, sometimes I'm doing paint, sometimes I'm doing something else, it keeps them on their toes, and it's making, our goal is to make more and more neural pathways to the same information. I need to do hand hygiene. And the more ways we present that in different ways, you make that from like a dirt road to a highway, so they can access that more easily. And that's what that novelty brings to it. But yeah, I like some glow germ. I love to show the transfer of things with glow germ too.
We've done that before. We put it on like an ink pen, and then it's like, hey, everybody sign in with this ink pen. And then people are like,
it's everywhere. Yeah.
But we will definitely try the paint, and I like that. Thank you all. And
so
I really appreciate Emily, because we didn't know that this was even a resource for us. So I'm looking forward to getting more involved with the leading age, and to I didn't know about VIPTA or Cup of Tea. So thank you all for letting us know that these resources are available.
Of course, we're happy to help. And that's why we're having these office hours, just so we can talk about our resources, but also promote other people's resources that we think that the centers can really find useful. But thank you so much for that wonderful presentation, Ginger. I know you have to hop off for your cup of tea. If anyone has follow-up questions for Ginger, we did share her contact information in the chat. Or if you just have a quick question, you can always send it over to me and I can forward it over to Ginger, because you have my contact information as well. But thank you again, Ginger.
Thanks, everybody. Bye.
So I have a few quick reminders for today. If you have not done so already, please reach out to me to confirm the delivery of the IPC Model Policies Notebook. 60 notebooks were sent in the mail, and I was lucky enough to deliver 10 notebooks in person last Friday. I had a wonderful day visiting all the centers and seeing all the important work that you guys do firsthand. We always talk about how each center is unique, so I felt really lucky to get to go see it and just interact and kind of get off a screen for a little bit. Another quick reminder is to complete the needs assessment. We would love to hear from you and provide you with resources and support to help with the implementation of the model policies. Betsy will drop the link to that in the chat. You can also check out our new webpage that includes the model policies that are available for download. We also have the tip sheets, office hours, slides, and recordings, and other updates on there as well. And the link to that will be in the chat, but we also have it linked in the office hours slides. And then you can always schedule a one-on-one meeting with me or request technical assistance to help with the implementation of the policies. We gave you these policies. We want to make sure that you have all the support that you need to be able to implement them. So we are here for you. And then you can also register for next month's office hours session. And the next session will be held on Wednesday, February 14th at 1:30. We have a quick poll for you to complete right now to determine the office hours topic for February. Betsy will drop that link in the chat if she has not done so already. And we would appreciate if you could please answer the question for us about which topic you'd like to see for next session. We want to ensure that we're discussing topics that are beneficial to your center, and hearing from you is really the best way to do that. And the registration is open, so Betsy will also be dropping the link to the office hours registration as well. And then this page includes my contact information, because I will be your main point of contact for everything related to the model policies and this project. I will assist you with implementation of the template policies, meet with your center one-on-one to provide resources and support, answer any questions that you may have. I can also put you into contact with HQI or Virginia Department of Social Services, depending on your question or your need for technical assistance when implementing the policies at your center. Betsy will drop my email address in the chat so that you have it, but I think most of you all get my emails anyway. And right now I will be stopping the recording so that you feel comfortable sharing with our team during the Q&A session.